Yeah. Yeah, we got a new camera. In the corner. You got a new camera in the corner. Mhm. Some additions.
Oh, right. Good.
Yep, we're ready. Yep.
Okay, all right. Hello, everyone. Start off with a little bit of science and then. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Hello.
Hi there.
Yes.
Yeah.
Kim, would you like us to get started with the presentation?
Orbit.
Is it working?
Can you guys hear us?
I can hear you.
Okay, I think I can hear everybody, but I'm not sure they can hear us.
Yeah, we got it now.
Okay,
Good.
excellent. Okay, are you guys ready for us to get started?
Yes, please.
Okay, awesome. So today we're going to introduce two TPAs to the team, and you guys can learn a little bit more about them for options for your renewal for 1/1. So our rep from Allied is going to take it away and tell you about Allied.
Is
Okay.
it possible maybe mute the mic on that side so we don't hear the reverb from, I'm hearing reverb from Kara's speaking. Is that better? And can you still hear us?
I'm not sure we're going to be able to hear them.
I know.
Should I get started here?
Oh, we have to unmute.
Yes, please.
Okay,
Okay.
sorry. Okay, thanks. That was a fantastic, awkward silence, but here we go. Give you a little background. I'm Dan McCarthy. I've been at Allied. I'm in my 23rd year now. So it's a company I'm very proud of. Still excited to work here. What I have today is just a brief agenda. I spoke with Randy beforehand. We've got to cook with gas here because we've only got 25 minutes. So my agenda is to talk to you about Allied, who we are, who we work with, how we view the marketplace. I'll touch a little bit on Allied Digital, and I know the focus here is going to be working with the Anthem network and then what we can do within the Anthem network. So a little bit of background first, how we view the marketplace. We're a little contrarian in nature, that we think the marketplace is broken. And there's a number of areas that we're trying to attack. So it's lack of transparency, unpredictable costs, complexity, the lack of flexibility. And those are all areas that, as an independent TPA, we're different than an insurance company owned TPA, where they're aligned with their provider contracts and their negotiations from a discount perspective. We're very different in that we're the largest independent TPA in the country, have a significant block of business in Indiana, but we're not tied to any one particular stop loss carrier, PBM, or network. So today, we're an Aetna pair, we're an Anthem pair, we're a Cigna pair. We work with 53 different PBMs and over 30 stop loss carriers. So we're in a unique space in that we're of the belief that there's no one size fits all solution to solving the healthcare problem. So everything we do is based on the specific needs, the location of the group, who the employees are, and what you're trying to accomplish. We work with over 200 different point solutions partners. So as you adapt and you grow with Allied, we'll be looking for opportunities and ways that we can improve the plan, and how do we integrate those. If a TPA is doing that properly and they're flexible and they're providing you with solutions and the employees have a good experience, that's where we have built retention, and that's how our book has grown over the 23 years I've been here. I still have the first group that I wrote at Allied over 22 years ago. We've changed PPO networks, we've changed PBMs, we've changed stop loss vendors, all under the notion that if we provide you with excellent member services, administrative services, and then the reporting infrastructure to manage your self-funded health plan, we should retain your business and you'd be happy to work with us. What you'll see from a claims paying standpoint is we're paying claims in 9 days with 100% processing and procedural accuracy. We do audit our claims on an ongoing basis, not only internally, but also externally. Outside vendors, including Anthem, will be auditing us on our performance. What you will see as the employer, and what your consultants and your broker will see, is really everything that we do, and it'll be updated on every 24 hours, our data warehouse. So you have everything from your claims, your diagnosis codes, your explanation of benefits, to your network performance, and we provide that on an ongoing basis. And then what you'll see from a deliverable standpoint is we have a client executive that's going to be working with you on a quarterly basis to show you trends and things where we think you can improve the health plan. What your members, your employees will see is extended customer service hours. So Monday through Friday, 9 a.m. till 9 p.m. Eastern Standard Time, and then 10 until 1 Eastern Standard Time. Now, the cool part about our customer service team and what we're doing and how we're tracking it is we are recording 100% of our phone conversations, and we can share those with you in the event that there's ever an issue with a particular customer service call. And we've got a speed to answer of under 30 seconds with a 98% first call resolution. So from a customer service standpoint, we knocked the ball out of the park. What the members see is Allied Digital. So it's truly a complete navigation, not only from a desktop, but then also from an app standpoint, where they have complete and total access to all of the claims information, the ID cards, the benefit information, the summary plan description, claims activity. And if we get to that next step where we have, we're entertaining another discussion, we probably like to show you all the capabilities and functionality, not only from the member standpoint, but also from the employer standpoint. And I know because we're short on time, I kind of shot out of the gate real fast. Anything as we go through this presentation that you want to address particularly so we don't get to the end of the half an hour and there was something that wasn't asked?
Just remember, Fountain County, you're on mute.
No, nothing from us.
Okay, perfect. So I'll keep going. And I do want to spend at some point, if you want to continue the conversation, I would love to get into kind of the navigation model and what we're doing with Allied Digital. But what I want to focus on and why you would want to hire Allied, and you may have seen this healthcare statistic, but it reigns true. 2% of your members are accounting for 47% of your spend. So it used to be when I first started in the business, it was like the 80-20 rule. Well, it's shrunk even further where, with 117 employees on the plan, you probably have 5 to 10 that are driving the bulk of your cost, which is a crazy thing to think about. Why you hire Allied is because we're trying to get our arms around and focus on those high dollar claims. So we do some very unique things. I'm going to talk about two that are unique to Allied. And this is in terms of if you worked with any other TPA, even another TPA offering the Anthem network, this is something that we do completely different. One being the Allied Advocate Program. So that's where we look at opportunities to intervene on high dollar claims outside of just paying traditional PPO networks. Within the Anthem network, we're able to focus on three pieces. Ambulance, or excuse me, two, dialysis and infusion. So those two categories we pay at Medicare allowable. And this enables us to save huge dollars. What you see is in 2024, we had 413 million in billed charges. 260 million would have been PPO allowable. What we actually paid was $96 million. So you far exceed a traditional network discount of 55 to 65%. And what you see when you come along particular high dollar claims, here's an example where we're paying at 4 cents on the retail dollar for a dialysis claim, and we save the group close to $1 million. Second piece, which is huge in the management of your claims, is enhanced case management. So this is large case management on steroids. It's where we're looking for additional savings even outside of the plan. So it's not just, are we going to pay the claim? How are we paying the claim? It's what other categories can we look to have, number one, a member impact? Can we help the member? And number two, a dollar impact. So give you an example, there's 12 categories that we're looking for within this cost management strategy, one being high risk maternity management. So we found in certain positions, situations, we can revert coverage to Medicaid. So that's regardless of the person's financial situation. If the digestional weight of the baby is a certain amount, we can move a claimant off the plan onto Medicaid. And what happens is it improves the member experience because they're no longer subject to deductibles and coinsurance and contribution amounts. But then it also mitigates 7 figures at times off the plan just in one high cost risk or high dollar maternity claims. There's other categories like frequent ER visits where our enhanced case managers dig into. We find out that the member may not have been compliant with their medications and they were using the ER as more of like a doctor's office visit. So in those situations, we find ways that we can get the member compliant with their medications, and we may look at things like a patient's assistance program to make sure that they get on track. So there's many opportunities outside of traditional just paying a PPO claim, amending your plan, shifting benefits. we're trying to enhance the member experience, and then we're also trying to ultimately move dollars off of the program. Um, what you'll see from an account management standpoint is a very different model in that we have a client executive, a strategist. So that's a person that's going to be working directly with your broker and your consultant to pinpoint opportunities where we can improve the plan or enhance the member experience. You're also going to have a client service representative. This is a different position than most insurance company or TPAs offer in that it's an extension of the HR team. So if there's a member that's having issues with a particular provider or they're getting bounced billed, that client service representative will call the provider, they will call the member, and they will bring resolution back to that HR team. So I would imagine, there's the size of Fountain County's population, there's not this extensive HR team. So we want to make it so that we're providing additional resources in the event that there's any issue that is revolving around the health plan, that we can jump in and get involved. And then you also have an account manager who's your day-to-day person, who would be responsible for running reports, making sure that you had all the data and information you needed to make appropriate health plan decisions. So I know moving kind of fast there. Do we have any questions so far?
No, continue, please.
Okay, you bet. So from an implementation standpoint, what does that mean to get up and running with Anthem? If we're looking for a 1/1 effective date. In a perfect world, we love a 90-day window, because what we're going to do is we're going to take your existing benefits, we're going to redraft those in the summary plan description. We're going to make sure that we have this launch, this weekly kickoff, this discussion where we're hitting our checklists. So by the time you go live with Allied for that January effective date, members have received all the enrollment materials, the eligibility information has been entered into our system. You've been trained on alliedbenefit.com, so you know how to use all the tools and resources. We've promoted all of the features to the membership in terms of what's available through Allied, such as virtual primary care and telehealth and care navigation. So we really want the members to be engaged. We want them to sign up for Allied Digital, so that all of their benefit and information is at ease and available for them at the time of that effective date. And there's a whole host of tools and things that we could go through just based on the time. I've been going kind of fast in terms of what's available. So our value proposition, again, very different than a traditional TPA where you're carrier owned, where we sit kind of in a different space where we design these a la carte solutions and then work with you over time to manage the claims. With the Anthem network, we have that different claims management capabilities with the Allied Advocate program, where we're looking at managing dialysis and infusion therapy. Okay. Any questions?
No.
It's a tough crowd.
Quiet group. Yeah, it was great that you were able to get through that so quickly. The bulk of it, I know there's a ton of information that we're not getting just because it's so quick, but I think we got the brunt of what makes Allied different and what makes you guys stand out. And I think that's what they needed to hear today, just to kind of do some comparisons. So we appreciate you for jumping on and explaining that and giving us the information so that they can decide what they want to do moving forward. So we appreciate that. I really love the HR extension feature. I thought that was really cool.
Yeah, absolutely. And usually when we have these type of meetings, we're in like an hour setting format where we walk through all the features of Allied Digital and the member experience, and then show the reporting what the employer has access to. So if we have a next discussion, we probably want to walk through how that works and the member experience.
Okay. We will definitely be in touch with how they would like to move forward, so that you know if we need another meeting or not.
Sounds good.
Kind
All
of like
right.
speed
Thank you
dating.
what was that?
Kind of like speed dating.
Yeah. Yeah.
Yeah,
Exactly.
yeah, yeah. Very, very fast.
Yeah,
I,
yeah,
I,
that was very good, Dan. Appreciate the overview.
Yeah, happy. And again, I was moving pretty fast because just from a time constraint standpoint. So if there's questions that come up, please just let me know. And obviously you're looking at one of our competitors. If there's something that you saw that we didn't talk about, happy to jump in again.
Okay. And can you share the presentation so that they can look through it?
Happy to. Yep.
Okay. That'd be awesome. I'll share it with the team
Cool.
once I get it from you.
Awesome.
All right. Thank you so much for joining.
Thank y'all. Bye bye.
All right,
Bye.
thanks.
Okay. Round two should be joining shortly.
And it's dialing into the same number?
I
Then
sent
another
them the
separate
same
Zoom conference.
link. Mhm.
I know it was a little bit of a whirlwind for you all to listen to, but any initial thoughts or feedback from the Fountain County team?
Not to me, no, no. I have nothing either. Not yet.
Okay. We did get preliminary stop loss numbers in. I sent those over this morning to Kim and Lisa. So if they haven't had a chance to share those with you, they do have them. What we did find out was that stop loss carriers will give better costs if you move to the Anthem network instead of staying with UMR. The contracts are better with Anthem, and therefore they give better pricing if you are with the Anthem network. We only have how your current stop loss carrier would handle that. CRC is working on getting how the other carriers that provided a proposal, knowing that you're with UMR, what they would think about you moving to Anthem. But the numbers will be a little bit better than what are on the spreadsheet that was shared. So that's just a little information to know moving forward.
Waiting on the next presentation. Right.
Mhm.
Hello, David. How are you?
I'm good. How you doing?
We are good. We are good. Okay. All right. David, if you want to go ahead and take it away, that'd be great.
Sure. I'm not real familiar with WebEx, so I'm going to try to share my screen, but
Share, I think share pretty much the same way that you would share on a Teams meeting.
Okay.
Just kind of share your document.
Where is it? Okay, let me. Bring this up. Why can I not find that? Why will it not let me share my screen? Oops. Trying to bring up my PowerPoint, but I.
Does it ask you which screen you want to share?
You shared for a minute, but we
Yeah,
we
you
saw
shared your
our
screen, but you
faces.
shared basically the Zoom.
Yeah, okay. Let me try moving this over here. Okay, this is what I want to share. It's a little different than what I'm used to here. I apologize.
All right.
Can you see that screen?
No, we cannot.
I'm not sure. There it is. There it is. Now, can you see that screen?
Yes,
Got
we
it.
can see your
Okay,
presentation.
I apologize.
You
I'm
just
so
wanted to
sorry.
start right at 6.
There we go. Okay.
That's right.
Can everybody see that?
Yes, we can.
Yes.
Thank you, David.
All right. Well, I'm very excited. I really appreciate this opportunity to tell you a little bit about Luminaire Health and who we are. Before I get started, are there any? I would certainly love to hear if there's any, issues or any concerns with the health insurance plan going on now. What's working well? What's not working? If there's any comments, I'd certainly love to kind of, this is your time to learn about us. So I'd certainly love the opportunity just to, if there are things that somebody has questions with, that, bring them up now. That'd be great. And I'll jump right in the presentation if not, but
We're good.
okay, perfect.
So just a little information. They're with UMR right now. They have United Healthcare, obviously, as their network. They've been with them for a while, and it's going fine. It's just, UMR has a lot of restrictions because they're owned by a carrier. And so we're providing them some third-party administrator options that are independent, so that they have more options to put in programs that the employees need and that can help with cost, that can make the experience better for Fountain County and for the employees as a whole. So that's kind of our point here today, looking at moving to the Anthem network and then looking at potentially maybe moving to a third-party administrator that's independent, that gives them more flexibility on how best they can help their employees.
Great. Well, I appreciate that tee up. Let's see if I can move this. Okay, just a little bit of a quick agenda here. I understand I have about 30 minutes. I'm going to try to go through this in about 20 and leave some time for questions. Again, my name's David Willett. I'm the Regional Sales Director for Luminaire Health. I'll talk a little bit about company overview, who we are, what we do. I'll touch on our service model. I'll touch on our implementation process. We understand if we don't get cases teed up from the beginning, there's always issues that linger. So I think it's very important to go through a little bit about the implementation. We've got all the reporting capabilities that any customer would want to help manage and take care of their plan. I'll touch on those, as well as member tools, from the not only an employer perspective, but also the member, the employee perspective, and how they can help them kind of manage their health insurance plan. So this is kind of a busy slide, talks about, it's got a lot of bullets on it here, but really who we are is we're a 50-year-old.
Hey, David.
Yes.
Slides aren't advancing.
Oh,
You might want to click on the next one.
is that, what are you seeing? What's on the screen?
Cover sheet. If you were to maybe click on that, that should bring up that next one, maybe.
Is it advancing there?
No, it's still on the cover page.
Go to slideshow up top, David. Next to record.
Just says end slideshow. What?
It's like we're in the view of the PowerPoint itself. Is there a separate one that's separate monitor that's showing the slide? There you go.
There. Now we see the agenda.
Okay. This is, like I said, I'm not as familiar with WebEx as I am with others, but okay. What, you see the agenda?
Yeah,
Yes.
that was the
Okay,
agenda. So
perfect.
I
So-
think the next slide was what
All right.
that one. Yep.
There we go.
Okay, so who we are as a company, Lumineer Health has been in business for over 50 years. So we've got a lot of experience from a TPA perspective, a benefit admin perspective, but we're really more than just a benefit administrator. We're a total benefit solutions company. We pride ourselves in significantly lowering and offering sustainable lower plan costs to our employer groups that we work with. We do this through unique strategies, cost containment strategies, as well as innovative approaches. So in 2022, we were purchased by Healthcare Services Corporation, which is the Blues for 5 states, Illinois, Texas, Oklahoma, Montana, and New Mexico. But we are operated solely independently. So we are not a TPA that operates kind of like some of our competitors that are owned by a carrier. They operate as totally independent. Another key thing I think about us is we are a mutual company. So we're not beholden to Wall Street. We are beholden to our clients, our members, as well as our broker partners. One of the things we pride ourselves on is being flexible. We understand that all of our clients have unique needs, whether, industries are different, hospitals are different than maybe schools, maybe different than the county governments. So we understand the need to be flexible. We've got over 250 integration partners, whether it's, point solutions that come into play. We can pretty much, in our 50 years experience, have pretty much seen it all, but we understand every customer is unique. But we do pride ourselves in being flexible enough to deliver those solutions depending on the client's needs. As far as the company goes, we've got over 650. I think that number is over 700 clients now, and we're up to about 1.3 million members. And we do have some other back office type products and other things that we do. But really, in a nutshell, from the TPA perspective, we bring a lot of flexibility to the table to take care of our clients' needs. And now, did that move forward for everybody?
Yes, it did.
Okay. So just from a flexibility perspective and, who we are, what we can do, we can integrate with about anybody, but we do, from a network perspective, I know we're talking Anthem here today, but we can meet our clients' needs, with really tying into several different networks around the country if we need to. We can integrate with different pharmacy companies. We do have our preferreds that are listed. Stop loss, we can integrate with anybody from a stop loss perspective, but we kind of have our preferreds listed out there. And we're talking Anthem today, and Anthem is in Indiana. They have the strongest network in Indiana, and they don't list who carrier X, Y, and Z are, but I think we could probably determine, one of them is probably United Healthcare, one of them is probably Aetna, one of them is probably, Cigna from that perspective. So, but Anthem has a very strong network with very deep discounts, and you can see the discount benchmark history, and the blue line shows Anthem's discounts. The X on that shows kind of the next best competitor. And then the average competitor are the little green arrows here, if everybody can see that. And please stop me if I'm going too fast or if anybody has any questions.
So the X is like the all-star team, right?
Yes, the X is the all-star team, yes. And then, but it shows, that Anthem's discounts are deeper than those, the industry standards there. Any questions? Any more questions on that?
No.
Okay, perfect. And then I'll talk a little. Was there a question? I'm sorry.
We're good.
Okay, perfect. I'll talk a little about our service model. We're only as good as our service team. And our client management team is a team of dedicated professionals that they're day in and day out. What they do on a day in and day out basis is take care of our clients. And the boxes that are highlighted in yellow are really kind of the client facing team members. And then the The ones that are not highlighted are kind of the more of the back office, I would say. But every account that we write is assigned a client manager and a client coordinator. The client manager, client coordinator are really there to be in lockstep, take care of our clients daily, the things that come up on a day in and day out basis. There's also an employer service rep who is kind of the liaison from the client management team to our claims team, and clinical resources that we have available to our groups on the back end. So we've really built out a service model that really addresses and takes care of our clients' needs. Any questions on our service model there from that perspective?
No.
Okay. And so I'll quickly move on to kind of an implementation. Really, and it says setting up for success, really when a group says yes and what's the next step and how they're going to move forward with this, that's when we really start setting it up with every group is assigned a dedicated implementation manager. And that's when kind of that dedicated client management team will get involved as well. So on the front end, we'll kind of have the handoff and work with the implementation manager and the client manager to start putting together the pieces behind the scenes to build out and make sure that client is ready to go at the effective date. And for this scenario, for Fountain County government, it would be a 1/1 effective date. So really, we would start putting this team together. And I've got a timeline here where it kind of shows it. Anthem requires that we make the decisions and have everything to them by October 15th, which really means ideally we'd like a decision really by the end of October, or the end of September, or the first part of October, because we have to get the plan build information to Anthem by October 15th from a timing perspective. So we start with the implementation manager and their team to build out all of the pieces that go into the implementation. So it's plan documents have to be built, the SBCs, we have to get the ID cards, and really it's a very detailed process. And we have weekly meetings set up with the client, with the broker, and with our implementation team to kind of walk through that to make sure we've got ID cards and all of those ready by the effective dates. Any questions on the implementation process there?
Oh, seems pretty smooth.
Analytics and reporting, we could spend another meeting on what we have to offer from reporting capabilities, but really this is your data. So it's our customers' data, and it's how we help our clients manage their plan, see what's coming up, what's the data showing, how do we better manage our clients' plans. But it's your data, you own it. We've got a data system we've private labeled Beyond Insights, and it just helps, our brokers that we work with, the broker partners have access to it, our employers have access to it, and it just allows, there's all kinds of standard reports. You can do ad hoc reporting, whatever you need to help manage your business, your plan for your employees. We can pretty much do it. We can slice and dice the data 1,000 different ways. And I won't go into it, just keep it high level. We've got different type of reporting here at your fingertips to just help, keep up with the latest data that you need to help run your plan. And then from a digital tools perspective, we have a employer portal and a member portal. So the employer portal can see things and help their members and kind of help manage their health insurance plan. Whether they're looking at EOBs, they want to see where their deductibles are. They want to find a doctor that's in network. In my family, we always lose our ID cards. So having a mobile app where I could just have my ID card when I go to the doctor on the phone is really helpful for me. These are just a couple slides that kind of show some things. You can see your balances from a medical perspective on there as well. So we've got all the tools to really help kind of start to finish from the employer perspective, from the employee perspective, help manage your health insurance plan. I know I kind of went through that very quickly. I know I kind of went through that very high level, but are there any questions, anything I can answer?
Well, not lying, but you were kind of charged with getting through it quickly. So you did a very, very effective job, David.
I have a few questions.
Sure.
How frequently is the data updated for your reporting that you provide?
Yeah, I mean, it's, are you talking about specific kind of data, or are there anything? It's pretty
Like
much
claims
real time.
information, how
Yeah.
is it updated every day? Is it updated just as the claims happen?
We have EDI updates every day with our vendor partners. So it's pretty much real time, or about as, I know some of my competition, there may be some that lag a month or two, but ours are pretty much real time data. I mean,
So that's what the members would see in their member app. It's pretty current based on
absolutely
what's happened within the last couple of days.
But there are maybe some, like, I think it depends sometimes with our pharmacy partners. I mean, you know, they deliver certain data to us twice a month. Some of our network partners deliver data to us once a week. But as soon as we get that information, it's uploaded into those. So there's not a 2-3 month lag like I hear sometimes about the competition. As soon as we get it, it's uploaded, it's available to our clients.
Great.
Super. Do you guys do any claims auditing?
We do. You know, we only auto adjudicate about 65% of our claims or so. So there's certain things that trigger our enhanced claims unit to look at those things. It may be a dollar amount. It may be some type of trigger where it's, you know, a high claims type of claim where we're going to kind of take a deeper dive into that. We're going to get our enhanced claim unit looking at that. Maybe it's some type of bundled bill that comes in from a hospital. There's always all kinds of issues there with those type of plans, those type of programs. So we're going to take a deeper dive into a lot of those. A lot of our competitors are auto adjudicating 80-90% of those claims that come through. And, you know, obviously that hits right to our employer's bottom line, that hits to the claims dollar. So we don't do that. We don't auto adjudicate every claim that comes through. There are certain triggers that we have in our claim system, and I can certainly follow up with more information on that if you'd like it. But we're going to take a deeper dive into a lot of those claims.
Yeah, and one of the things that I don't know that you kind of hit on, you kind of jumped around on the page a little bit, but the SOC certification, I think, is really valuable in terms of the quality of and the surety of your systems and the way that you manage data.
Yep, absolutely. Yep.
Are there any other programs that Luminaire is kind of known for that are special and specific just to you guys?
Well, I mean, I do think that the flexibility piece is something we really hang our hats on. We can integrate with anybody. I think our enhanced claims unit that I just mentioned is pretty unique in the industry. You know, we do have the capability of, you know, any point solutions you're interested in, we could certainly bring those in and put them in our, you know, every customer is unique. Every customer is different. So, you know, we can create a plan that is best suited for that individual client.
Great.
Awesome. And you guys will provide, as you see certain claims come in, you guys will maybe suggest certain programs that could be put in place that might help with a large claimant. Is that correct?
Yeah, you know, we have a whole utilization management and case management team So as certain claims come in that, that we may know that may linger, maybe it's a cancer claim, maybe it's a diabetic or dialysis type claims that come through, we do have those in-house case managers that are going to work with those members, getting them to the best place for the best treatment that they can get in, within their networks. So we do have those that kind of steer and guide and work with our members on the back end when they're going through, whatever the case may be, those claims.
Okay. Does anyone else have any other questions?
We do not. Thank you.
Okay.
Thank you so much
Awesome.
for the opportunity. I really appreciate it. Thank you.
David, thank you so much for your time today. And if you could share that presentation, that would be great.
Sure.
And I'll send it along to the team and they can spend a little bit more time digging into it.
I'll send it to Randy right now.
All right. Thank you so much.
Take care.
Thank you, guys. Appreciate it.
Thank you.
Okay. Fountain County, do you guys need anything else from us before we hop off and you guys can do your regular thing?
I think we're good. Thank you.
All right. Awesome. Have a
All right,
great
everyone,
evening.
have a nice night.
Department heads, we're gonna hold off till joint meeting, as well as public comment, we can hold that off to the joint meeting as well, so we can get through our initial meetings real quick. Can I get a motion to approve, September 2nd minutes?
Make the motion to approve.
I'll second, all in favor? Aye. Motion to approve the claims.
Make the motion to approve the claims.
I'll second, all in favor?
Aye.
Will, clerk's monthly report, can I get a motion to acknowledge?
I make a motion to acknowledge the monthly report.
I'll second, all in favor? Aye. Tracy? Hello.
I'm
Yeah, can you come up to the, come to the podium and say, it's new camera graph here.
Christy Reasoner. I'm the clerk of Wabash Township. And I'm here in behalf of some constituents of our township. Especially those on South Barker Road in Weedersburg. They called us with a big concern. Don't know if I have enough copies, but this,
Yes.
this, Midwest. This is, this Midwest Motocross Racing event. Is being put on this weekend in our township. And they called us wondering if we approved it. And we said, we've never heard of this going on. And so they asked, well, how did, this get approved and how come us residents on this road know nothing about it? They heard about it called us from someone, a contestant who's gonna be in this race. And then they saw it on Facebook. And that, but there was no numbers, no phone numbers or nothing, to contact anybody. Now, I contacted the person whose address this is, we've been there, and they're like, well, we have nothing to do with it. And I said, well, your address is on here, and he said, well, because it's next to us. And they knew the people who were coordinating it, and they knew the property it was on. Now, the biggest concern of the residents there is it's supposed to attract about 1,500 people. A lady said maybe 1,000, but even if it was 500, where are you gonna park them all? They're gonna be staying the night. It's a 2-day event. As far as I know, youth are involved. And, so we started to do some research because we had no idea, about how to go about getting a permit for an event like this. I was assuming there may be something. So, I had did some research online and I found this. And it said to contact your local, no, wrong one. did a little bit of research in 2 different ways. Here we go. It said to contact your local government or clerk. I just put in to host an event in Fountain County, so I came here and asked the clerk, and she was sort of surprised. As well as so I think this has never been, you know, an issue before, I'm thinking. And she's like, no, I have no idea about this. And I said, oh, okay. And we went to the assessors who they put the information on the computer, you know, for Fountain County. And she's like, I've never seen this. Where'd you get it? And I said, online. So I went back home to check it out, and it must have been AI generated. It does mention Petersburg, Attica, and Fountain County. But it must have been AI generated. And so from there, when I found out, she goes, I don't think we really have an ordinance out there concerning something like this. And I was thinking, I guess we need to get one, because this must be the first time this has happened. Now, I did look up Indiana, in.gov, and they do have something on motocross events in Indiana. Some rules and stipulations. But what I'm looking at today, not only I think do we need to put something together for this, is we need to, figure out exactly this weekend. I have on the thing I gave you, Jonathan Cook is, and the phone number here is the guy who's putting that event. He's the coordinator, I guess, of the event. I did not contact him because I needed to gather information and I couldn't find any information. So who he is supposed to go to, who is he responsible to? You know, are there gonna be any, you know, any emergency vehicles there, you know, like, yeah, ambulance, fire, there's young kids involved. And parking, you know, where they can park all that. I did get a hold of, Terry, the sheriff, and he did mention that he knew about it. And he said he was having some signs put up because I guess the racetrack is gonna cross the road twice. And he said that he was gonna have Jason put some sign out that says caution. But if they're racing across the road, how can you caution when it's a race? And is anybody monitoring those barricades?
Can I ask you a question?
Yes.
I know where the where it's at. Is it gonna be in the woods in south of where that address is?
Well, she said it's supposed to be back in that field. Now, I don't know how big that field is. I don't know if it can accommodate 1,500 or even 1,000. She said maybe 1,000 people. He says, you know, it's down this road. We drove past it. There's this little lane. I don't know what it looks like back there. I don't know how they set up the racetrack. We were just researching what our permit rules are and who, like if someone comes to our township and say they want to do an event, where do I go? Is there anything? And I couldn't find anything. But as of this weekend, I'm not sure, you know, who or what. They told me it's back in the field, but I don't know how big it is. Can it handle that amount of people? And what about everybody staying the night? It's a 2-day thing. Do they have any accommodations? You know, so this was something they suggested we come to the commissioners meeting to they, you know, the assessor, the different ones, the clerk, she goes, you might want to go to the commissioners meeting and bring it up to them. And I don't know what can be done for this weekend on the event, but it's supposed to be this Saturday and Sunday.
Well. This is the first time, I
Doris,
think any of us.
Are you aware of the event?
Yes, I just found out that last week.
Okay.
What I got from the call I talked to said They mine ambulance, they have first responders that come. And. But it was first responders to take care of it. I advise that. I have an ambulance there, I think that it's long, so we can have them.
Yep.
So I made my crew aware of it. I can't say that's actually Perrysville Fire District, they know of it. But I don't know if they're gonna send anybody out there, right?
I know Terry said he was going to, patrol it. They must have contacted him as well.
Terry Holton, which John couldn't know.
Okay.
Yeah.
In there, so.
Uh,
Now, I know a lot of people on that road, they haven't heard about it. The guy who contacted me knew about it because the contestant told him. He was in it, you showed him the route they're taking and. I know that, they're concerned about emergency vehicles. Being able to get in for them personally, they're concerned about, I guess there's a lot of elderly on that road, they're concerned about. Noise, I mean, obviously races, but they're staying the night, how. Loud and loud that can be, people parking on the road, Indiana roads, they're not real wide. Who's, going to be watching all that? Do they have somebody watching? I don't know if they're barricading it, I don't know, now I was told. They're closing the road down, then I was told. Terry said, well, they're not closing the road down, but then the constituent had the route and they're supposed to cross the road. So do they have people watching that? Or it just sounds like a big red flag. Maybe they do have their P's and Q's all together, but I think we do need to come up with something that if someone has something like this. They're able to go and make sure that everything's in alignment. I don't know if they have insurance. Do they have insurance? I mean, it sounds like a liability thing waiting to happen. And then who's responsible? Brian Thomas, it's his land. So who's responsible? Can they come back to the township? Can they come back to the county on it? Or is it just his responsibility? So, a lot of red flags, of this event happening. I'm not against an event like this if it's done safely. And within perimeters and accountability and whatnot.
There has been a precedent set in the county when Pete Scott had his for 2 years. In the rural area of Van Buren. It was in the rural area and there was several, just as many as what you're saying there, and he got with the people that did the race, got with the sheriff. And well, you remember that, Darth? Was when he had his motocross race.
Yeah, I remember that, yeah.
2 years, had 2 years time.
Yes.
But we've had them, and they just got with the sheriff and.
Well, it's nice that you have had them, but there are residents
Yeah,
to consider, and they have not been made aware of this.
they were this,
Yeah, this one,
Who was it?
they haven't been made aware, there has been no. This gentleman found out
Yeah.
because. Someone who's participating in it knew him and they talked about it, so. The residents are not aware, all the residents, I wanna say. And, there's. A lot of concerns with them, which. There's no phone numbers, so they can't call, so. I know this is stuff that we do in the past, but nowadays there's a lot more accountability. The resident was talking about even with Homeland Security, there's measures that you gotta take nowadays. Because of big events like this, it's a different world.
so you're just saying John hasn't done his homework and hasn't got.
I don't know, I have not talked to John, I did figure it was the township's responsibility that it's a county thing. We are just talking on behalf of our constituents. And we were researching that, and finding there is no rules or regulations or nobody to go to regarding something like this. To hold, to make sure they're doing the right things and holding the right,
Tina, did you have?
Yes, I'm emergency management and they can't contact me to do an event plan, so they do not have to. But there's a lot in the county that has events that can contact me. They have been like that for years, so we do have event plans for like, the Apple Fest, the street fair and all that kind of stuff, but there is no permit or anything you have to do.
and I'm not saying that we necessarily have to charge. I'm not looking for the money or we don't benefit.
But most of them to talk to the responders, so everybody kind of knows what's going on. Like there's a race over in. Yeah, and they don't close the restaurant, they do put signs out. It can last, almost to the last run, so it can last 2 to 3 days. We do have an event plan for that, but we don't do anything for it, we don't even stage for that, nothing. We just know and is aware of it.
Yeah, but Tina, they're crossing county roads.
I'm
That's
not
not-
saying that, I'm just saying if they haven't contacted us. There's nothing that says they have to.
Right, there isn't, well, there is in the state. For motocross, there is in the state rules that motocross people have to, if they're gonna have a motocross race, they have to follow those rules from the state. So there is nothing local, you're right, and that's what I'm bringing up as well. I think something local needs to be put in place. That if someone comes to me and wants to have a race, have an event, it doesn't even have to be racing. Who do they go to so that they can comply to safety measures and safety rules? There has to be safety somewhere, there's liability, who's liable?
They can go to any, they can call any responder and talk to them. They can go to the website and I do event plans. But like I said, they have to come, I can't find out who all is doing events that they don't.
Right, but if we have a set person who is in charge government wide, like this AI when I'm passed out. Says go to the clerk. Okay, if they know that, I mean, things are changing, I understand, it's always been this way for a lot of years, but things are changing, the world is changing. And for us not to have something in place that they can say, do you have an EMT? Do you have insurance? Do you have, blockades? It even shows here in Indianapolis, they have, if you have a blockade off a main road, someone has to be manning that the whole time the race is on. We have that in place. I'm not looking for, do you need a permit and you have to pay for this? We're just looking for accountability for those who are the residents. I mean, if that was on my road, I would be really upset. If they're just gonna block up my road and not tell me, I'm gonna be upset. If, a child got hurt, it's not my child, but still, he's hurt, what do you do? Who's gonna pay that liability? Times have changed, we have done things.
So to get with this, I've dealt with this, I've raced under this company before.
Right.
IXDR is another division, the Indiana Cross Country Division, raced for them before. Most all these companies hold their own liability insurance. They have their own first responders on staff, they have their own security for every event. It's all primitive camping. There's no water usage per se or anything like that. They have to have this sanctioned body, they have to go through so many things through the state to have this. And they have the liability if someone gets hurt. They have the liability if someone attending the event gets hurt. When you race an event like this, you sign a liability waiver that basically says you're participating in a motorsport. There are risks involved. You assume somewhat of your own liability at that point in time. As far as crossing the county road, that's the first word of that, but these guys have to. These are on the schedule, like they're making their schedules for next year now. So this just didn't
Right.
happen 2 weeks ago.
That's what's sort of interesting is why have the residents not heard of it on that road? Should they not have been told? And what kind of barricade do they have in? I was told they were gonna have caution signs. Are they gonna have barricades? I mean, in a race, it's not like you're riding a dune bike and you stop at the road and look both ways. So are they having people man that? To make sure that if an emergency vehicle is needed for a resident. They can stop it, move the barricade and let an emergency vehicle go through.
That's a question for them.
I mean, that's one of their concerns is themselves as well. And, a race crossing the road and not being able to get through or emergency people being able to get through. That's one of their concerns as well.
Yes, sir.
My name's Mark McDowell, I live on Market Road. My wife and I moved here 3 years ago, nice quiet community, we moved here. Building a house out there, I found out Thursday that they're gonna have this race. 1,500 to 2,000 people. And time I found out about it, it was because the race was canceled at another location. So they decided we're gonna hear about fishing somehow. Some people got together, some of us got together last night and talked about all of our concerns here. Obviously, I think I can ask you, most of the people in this room, you have a place out in the country, nice quiet place, if somebody told you, or if you found out, well, there's gonna be 2,000 people across the road from you. I doubt very seriously that any of you would be very happy. I know you were a racer. I've been in some of the racing too, and know how that goes. You have just as much right to do that as anyone. But we don't get notified, still have not been notified. Got out on Thursday. And I think we should have at least got the common courtesy, say, hey, we're thinking about this. It's not been going on for a long time because it was a canceled venue, they had to move it, I understand. But I don't think we were treated very fairly here. I don't think we have a lot of choice, and they are gonna cross that road. And they're not gonna cross the road 5 minutes and then open it back up. There are 8.
Start at 8 a.m.
Yes.
They said.
8 to 6. And it's not a 2-day event, it's a 3-day event, because they're all coming in on Friday. And they're gonna come down Market Road, 2,000 people. Traffic's gonna be backed up on 32. At a really bad intersection. I don't know if anybody's been to Market Road on 32, sharp turn there. It's not very, nice location. It's a catastrophe waiting to happen. If you've got traffic backed up there and 2,000 people getting in there, they will be traffic backed up there. I don't believe. We're not very happy about it, but we know also as a landowner, you do what you want. We've also found out Fountain County doesn't have a lot of regulation, which honestly, I get that. I'm not a big regulating person either, but the state has some things that are put in place through Homeland Security, which has to do with the planning. And there's notices that should have been given. And we're concerned about I know a lot of these organizations are exactly like you said, they have their own insurance. They know the liability, you sign a waiver, they're gonna cover their backside. But they don't have. With 2,000 people with non ambulance, I don't know if that's.
We won't have one voted for that,
Right.
but we'll have 911 ambulance available.
Okay,
They will call some.
so they may have their own, ambulance service, I don't know. But I'm concerned here with the amount of people, just managing traffic on 32. If you had, a sheriff at each end of where you're at the intersection, you're gonna have to devote, or 5 individuals to traffic all week long. And then they're gonna stop traffic on Parker Road in 2 places. They're gonna be crossing the road. So we're not very happy about it. I'm really not very happy about it in that we didn't get any notice here. None, still haven't. We moved down here, and I'll tell you, we love this community. Been down here 3 years, we love it. Great place, people have been really, very, open arms, breathing type people, but this sort of sets bad for me in that I get no notice from a guy who's supposedly my neighbor. He is my neighbor. And I think he knew about it, and I think unless I'm incorrect, he tried to do this. So when nobody found out till it was too late. I mean, we could be getting Friday, we're getting ready to go see our granddaughter. We pull out, we can't get out because the traffic's backed up on Barker Road. We've got some elderly people there that do get special needs for medical issues. We have a medical issue. What do we do here? They're running a race across the road, and that road will be closed all day. They have multiple races, so they have to close it. I mean, how long is the race? 10 minutes?
You depending on class, usually, so your 6 PM race will be an hour plus the line. So it'll be 7:30 before it's over.
Yeah, so, I mean, that road is closed down, get that many races in, that road's gonna be closed down 10 hours, 8 to 10 hours. I mean, there's how many races on Saturday and then Sunday. So, here, you know, I'm just asking for a little sympathy here, I guess, in that if I'd been notified and I'd had a chance to come here and what's debated, whether we want to have this event, let's be fair. I think if you had this on your road, you'd want the same. We didn't get that. And so anyway, it'll be whatever it's gonna be, I guess. You don't have to have it in the back of the committee. And I know there's not a regulation here. But there is to the state. And I guess really, if you don't have that here, state regulation should supersede whatever you had. Or if you had something, you could supersede what the state had, again.
Or if somebody wants to plan an event, even just a checklist they should follow, a safety checklist for their own. In case another event like this does rise up, if someone called the township, how do I plan an event? I don't know. Do we have anything? I don't know, you know, a checklist, even if it's just a checklist for them to think. You know, boy, yeah, I need common insurance, so I probably need an EMT maybe there. Yeah, tell the neighbors, have a quiet time, you know, quiet between 10 to 7 or whatnot. Just a checklist so that they're aware of what they want to do, because the country is the best place to have an event, you know, if you have property and whatnot. We're not against events, just allowing courtesy for the neighbors. And that they hold a safe event. I know everything it entails, but sometimes if you don't host it, you don't know what it entails. So even if us township trustees or whatnot have a checklist that they can follow and, you know, be safe with it.
Some of the individuals also were concerned about if that track crosses Prairie Creek. They went to the old DNR. I just put some property into CRB. They were very, very cautious about anything along the waterway and the racetrack going through the water. This creek, I don't know if it is or not. But the track is close to Prairie Creek or going across it. They're doing that. That's not. I don't think that's what the DNR. I don't know. I bet not. But also there was one individual who's this farmer, he said, yeah, what happens if somebody wants to come down here, it's harvest season. Start beating up, start pick our corn, what if we come down here, we don't know what's going on, we get down here in the road, how do we get out? How do we get across it? And they do, they go up and down my road all the time. So, like I say, I just, think more than anything, I guess, we feel like we're living blindsided here. And the road closure is huge. I mean, I just saw the minutes where Terry Holt has to ask for road closure. So anyway, I appreciate your time. That's my concerns. I hope you understand how I feel. And I guess we'll say.
Thank you for listening. We appreciate it.
Well, thank you.
Thank you.
Motion to open the business for renovation of the health department.
I'll make a motion to open the bids.
I'll second, all in favor? Aye. One motion to do all these transfers, can I get a motion to approve all the transfers?
I'll make a motion to approve the transfers.
Second, all in favor? Aye. A motion to approve this contract, preventative maintenance with the flex rate and washer compactor. Jail. Yep. Thank you.
I'll make a motion to approve that.
Second, in favor? Aye. Dixie B closure. Like to close that road for an hour, we've done that before.
Yep.
That
That is to accommodate a wedding.
But it's a wedding.
The wedding is the 20th and this is the 27th.
It's just coming Saturday.
This says the 27th. This
Should-
Saturday is the 20th.
Should be the 20th.
Okay, I want to make sure that right.
Yeah,
Right.
it is the 20th.
Thank you. Can I get a motion to approve?
I'm making a motion to approve the closure for.
Second, in favor? Aye. Interlocal agreements. Looked over that, Ethan, you looked over that?
Yeah, I just looked at.
You want to, yeah, go ahead. Done. What do you got? Interlocal agreement.
Yeah, did you get those papers?
Not yet.
Okay.
I haven't had a chance.
We can talk about more enjoy here. Okay, I need a motion to approve.
I'll make a motion to approve the agreement.
I'll second. All in favor?
Aye.
Aye. All right, our next meeting is going to be on the 29th, 7:30. Because we have to approve some, we have to look at bids for the health department. So that's why we're having that one. And we're both gonna be a little busy. That's why we scheduled it for 7:30 to make it as late as possible. They will be here for budget, so. Can I get a motion to close? Please.
Make a motion to close.
Second. Favor? Aye. All right, call to order the joint meeting on September 15th with the council, with the commissioners.
Call to order the Fountain County Council portion of the joint meeting.
All right, let's go through department heads. Whoever wants to go first. Or if we got anything. Okay. Here you are.
Just a few things, collections, we're ahead if you look at. End of August of this year versus end of August of last year, we're quite far ahead. She's done a pretty good job keeping them on that. July was down a little bit, but insurances right now is very challenging. 1 month and maybe a lot of good selections, the next month will be up. So if you look at August selections, we were up quite a bit, so she's done a pretty good job making sure we stay on top of that. Run numbers, we are down a little bit. I feel they're kind of stabilized now, considering we're coming out of COVID. You know, and I talked to some other organizations and they're down also. We're not down by much, I think we're about 50 to 60 run, but that could change pretty quick. I reached out to the representative, the sales rep on the ambulance, he's got to call me tomorrow and talk to me, so. I don't know what that means, hoping that. They've got it almost done, but I've got a feeling that's. Not sure yet, so once I know, I'll let you guys know. That's all I got. You guys have anything? Yeah. Thank you. Thanks, Gardner. Yes.
Yeah. So I'm not
Based on everybody.
Does health department go through super that this. Yeah, well, I really can't do anything, so.
Okay. You can continue.
Yeah. So,
Okay, transfers, the sheriff's department, equipment repair, to repair and maintenance for $2,400. And I've got no numbers on the highway department.
Hello. One question on the repair and maintenance on the sheriff department, is that something from the July, special ed? You know, that's what.
Yeah, if it's repair and maintenance on the jail, it should be coming out of anywhere. They've got the funds to do that, but do they not? Yes.
It's out of what it's for.
Yeah.
It's
and-
part of their first.
Yeah, depends on what it's for, but it's, but they're not seeking additional transfer, so that. From equipment repair to repair.
Cause it's in the, they have it in the red. Their repair and maintenance is in the red.
It's just not general repair of it. Nothing, nothing major.
No, nothing major.
And they should, out of that. Do we know what the high money is?
Yeah, I have.
It doesn't say what equipment it is, but. There's no definition of what equipment is unless.
Let's transfer 7,000.
And for $7,000 for gas and oil equipment to buy 2 new salt sand spreaders. I'll make a motion to approve both of those transfers.
All in favor, say aye.
Aye.
Aye, 5-0.
Can I ask a question about on the health department? Is. I know we're getting bids, and this is to fix the building up, right? And-
Yeah,
And is that gonna come out of the state's money that they're giving us?
No.
Or are we?
no, that was the down payment. Right,
Mhm.
yeah. We use the
HFI.
HFI funding to do the pay the down payment.
Oh, okay, the HFI is used for the down payment,
Yes.
okay.
And I believe and you can correct me if I'm wrong, Jenny, the repair. Renovation, however you want to say it, to the actual health department is so that when you walk in, it's private, there's no privacy. For anybody that may be back there visiting as a patient to the health department. It's all open when you walk in, so they have to build out a wall to make it private.
Then build that, right?
And build the restroom, the shower in it, so. And that's for patient use.
We want to talk about the interlocal agreement, with Warren County.
Yeah.
So it's 400,000 a year. And then they're going to base the. The yearly bit off of the state's. Yeah, inflation adjustment from the state, but we're gonna start off with 400. What Warren County agreed to this morning
And approved on their end.
and approved on their end. Which is 70,000 more. What we were getting, so. Have any questions?
I currently do have any. It doesn't mean I won't.
Yes. And this is for 3 years too. I said that, but this will go through, the rest of Pedro Vica's term. Will be up for negotiations, so. 3 years. And they would like to do it every 4, but since we're all already started, that'll work for 3 years. Go more from there on, so.
The full clear out for the 2000.
That's a 20.
You know how many funds was paid? 911 bills out of,
There's three different ones.
okay, so there's the statewide 911, non-reverting,
And then, yeah, and then county general.
and, oh, county.
Yeah.
general.
How does everyone feel about the interlocal agreement?
Yeah, better work before, but I still like to see if they do, so it's what it's been.
Is there anything to reference of equipment, anything like that?
That's, the way it will stand is, it's all out, so you won't own the equipment.
Yes.
And that way, in the event anything should happen in this agreement fails, we can still continue on just as we are. We just have to take up all of it.
Yeah.
I think this puts us at what, 50,000 over.
We were getting what, 330, so it should be 70, so. Which puts us, I think, makes up for the difference, the losses lost, but we've at least stopped it from here on out, so.
And then my only concern is whether we have a catastrophic health bill.
Yes. I don't think they're gonna budge. I was going to take a win as a win. Leave it at that. Granted, something detrimental would happen, but. Again, they are stuck on making sure the flat works for them because of the budget makes their job a lot easier. Which I completely understand. Yes, I completely understand, but can't budget for
We
the
tried,
disaster.
yeah, and we tried for more. We had, I
Yeah, we
mean,
did.
Aaron had a number and they said there is no way that they would be able to get their council to agree to that. And they did not want to walk away,
Neither did we.
and neither did we. So trying to,
That's all.
yeah, it's a start.
Yes.
So is everyone in agreement for me to sign this document?
Yes.
I'll make a motion.
No second.
Denise made a motion for me to sign the interlocal agreement. It was seconded by Jim. All in favor, say aye.
Aye.
Aye, 5-0. Make sure I get this signed on the right line.
All right, we will move to public comment. Let's make it short so we can all go home. Yes.
Do we have a date and time when those bids need to be received?
Yes, they have to. Yeah.
29,
By 3 p.m.
3 p.m.
The last commissioners meeting you guys had, I told you I had the agency meeting. That was sometime in August, and I think the 11th, maybe or something like that. 3-hour long marathon.
There's a couple things in that really disturbed me. I want to bring them to light. One of the things, probably the lesser of the two, Jim, you brought up the fact and pounded the book, state law on the makeup of the committee. It's not legal according to the way it is right now. And to that, Jessica Anderson made the reply, well, I'll volunteer to be an independent for you. On paper. But then it came out, well, she had voted in the Republican primary. So, and the second thing that happened, and I know you, KW, and I know you, John, tried to stomp this as best you could. Made you very nervous, and it, well, I should. She brought up something that shouldn't even involve the APC. And during that, it was and I didn't catch it all, but it was an ordinance or something that was proposed at one time or another and didn't get any action on it. And she thought that gave her an out to throw stuff on the wall and see what stick. Stuff. So anyway, you went on for about 2 hours. And you guys was trying to put it happy that she wouldn't give up. And finally, she made the comment on tape again that, well, this should have been, this is a P and it should have been an S. And I dwelled over this for months, she said. I actually thought about just changing that on my own and trying to submit it without anybody knowing. Now, is that the kind of people we want on our committees? She should be dispensed from everything in this town. That's all I got to say.
Well, I want to say one thing, Bill. One, we have a letter from the Democrat Party that states they are not putting or offering anybody up to the APC. So we've cleared that through legal. We're good. Two, about Michael Cunningham being a legal member. If we can all read, I suggest, I'm assuming everyone can read, including Tim, the commissioner, you go to the website. It says resident, not landowner, resident. Well, I'm pretty sure he lives in the county, outside of the incorporated area. So we're clear. Now your comments on Jessica, I'm gonna have to go back and watch tape because
it's there.
I'm not arguing that at all. I'm saying I've slept a few nights and had a lot of things with this brain since that meeting. I will go back and review it.
Well, you only have to watch about the last 40 minutes of it, but I'll save you some time.
Okay.
But yeah, I mean, just the fact she entertained the thought of illegally changing a document and putting it in the file without anybody knowing.
If that was stated, I'm not arguing that it wasn't.
Am I wrong, John? Am I wrong, KW?
I'm with Aaron. I would have to go back and read.
I will go back and watch the video.
I said right there in it, but like Aaron said, I've had slept and had a lot of things going on since then. If that's an point that needs to be, sounds like it definitely needs to be validated, then we will review the tape. That's why everything is recorded.
Fair enough.
Yep. Absolutely.
Any other public comment? Yes, Sue.
I like the TVs here.
We have one more. It's supposed to be going back there. So we can look back.
We can look straight and left.
Can I ask one little more favor? To get microphones for every person.
They're working. Every single person on this table is put that.
This is the new soundboard and every little black thing sitting by next to Jim's board and around Jeff and Denise and that, those are new microphones. So everything.
Every
hopefully
out there
will be picked up a little bit.
microphone.
Even if somebody's.
That should be hooked up as well. Yes. Yes. We're just slowly getting there, but.
And talking about reporting, I still have not seen the reporting yet of the last council meeting.
The council meeting is not up. The BZA is the council meeting as of whenever the last day I checked. And I don't remember if that was over the weekend or what, but
And we do have a new camera system.
Oh, so.
yes.
Instead of them dreaded motion now.
Hey, KW.
Yes, sir.
KW and John, I want to ask a question on the APC. the BZA doesn't have a budget. They have no budget, so why are we having meetings? And they're not even approving any zoning, they're having meetings. I mean, and I don't understand that. I mean, they have no budget. They're only there to approve rezone, correct?
That is
Okay. I just,
When they ask
got-
them to do something that required money in their meeting.
no, but
That's
you have board members coming, meetings she's trying to have ever so often, and I would think they want to pay them. When you,
It's a problem.
huh?
I think it's a problem that probably has to be dealt with.
So.
So what? Could you tell us again what the purpose of the BZA is?
It's not to meet all the time and go rogue. I mean, it's. Something has to come in front of them. They can't grab stuff and bring it in. And I was under the understanding that they have the same attorney as the APC. Okay, so. Anything further than that, I would defer to her.
Yes.
Just like to thank Mr. Jones, who did get a caution sign, going out of Covington and across the bridge. And, but the trees block it, and they are almost in the middle of the bridge, so if those trees trimmed, it would be very helpful.
Okay.
And we also have an issue with the cemetery entrance. Oh, we call them pillars that are still very dangerous. And I'm thinking Mr. Jones was going to contact the cemetery commissioner. I don't know how long that would take, but I appreciate his time. Thank you.
Carol,
Why is the Dixie Bee going to be closed? Did I miss that?
a wedding.
They are having a wedding that is taking place very close to the road, and they called and asked us and Sheriff Holt and Mr. Jason Lewis asked basically everybody if they could close it for 1 hour on Saturday evening. Yep. Sir?
Yeah, I was just wondering on the Alton Solar, has there been a new permit issue for this still going by the issue one? That was the issue.
The conditional permit is what has been issued.
That how can they be doing what they're doing when that 60-day time limit is up on that? Or
There- and-
what's in,
There's been threat and litigation about this, not just from Dolphin, but from several people in the county, and I've advised the commissioners, look, we're at the point now where I'd really love it if you didn't talk about that in a recorded public hearing or meeting. So I don't, just understand, I've kind of told them, please don't talk about this.
Any other questions?
He's coming on there right now.
Oh.
Yeah,
The
yeah.
council meeting.
He's,
put on.
yeah, he just didn't realize,
Yeah.
so it should be on there now.
All right, can I get a motion to close?
Make a motion to close the commissioners' meeting. Thank you. All in favor? Aye.
Maybe that's what you propose the council meeting.
Recess.
Or, I'm sorry, may I get a motion to recess the council meeting? Please, seconded by Dudley, all in favor, say aye. Aye, 5-0, good catch. Oh, we don't wanna do that, we don't wanna do that, we don't wanna have that re-advertise and do all that.
oh, you've got to get a speaking.
Thank you.
And I emailed it to you, so, but